Contextual Errors and Failures in Individualizing Patient Care, a Multicenter Study. Standardized Patients and Scenarios.
Hi, I'm Dr. Saul Wiener.
And I'm Dr. Alan Schwartz. We're the first two authors of the study Identifying Contextual Error, Unannounced Standardized Patients Expose Failure to Individualize Care.
Part of the study utilized unannounced standardized patients, or SPs. We thought it would be helpful if we showed how we use the SPs in a video.
In this recreation, we show how a participating physician was visited by an unannounced SP in their clinic. The SP is an actor, trained to portray a patient case the same way each time. This was scheduled as a first visit with a new patient.
Hey, Mr. James.
Hi.
I'm Dr. Murray, and you're new to the clinic?
Yes, this is my first time here.
Well, welcome. Did you have something specific that you wanted to talk to me about today?
I wanted to talk about my asthma.
SPs were trained to present a common ambulatory complaint accompanied by a specific set of verbal clues or red flags for each and every appointment. Then, depending on the visit, they were to present answers to probes for those red flags from one of 4 variations.
Okay, tell me about your asthma. How long have you had it?
Well, I've had asthma since I was a kid. I kind of outgrew it till about 5 years ago when it started getting worse. It kept getting worse and got to the point where I was having episodes about twice a week. Now, a couple months ago, I saw a doctor and he put me on Pulmicort, and it helps, but I'm still having episodes at least once a week, sometimes more.
Do you have any specific triggers for your asthma?
Well, that's kind of difficult to say. Sometimes cold weather outside, sometimes exercise, sometimes I wake up coughing and wheezing.
The statement, "sometimes I wake up wheezing and coughing," is a red flag that indicates there may be an atypical biomedical reason for the patient's complaint, specifically gastroesophageal reflux, or GERD, often referred to by patients as heartburn. This biomedical red flag is intended to see if the physician will probe further.
Well, it's difficult to say. Sometimes cold weather outside, sometimes exercise, sometimes I wake up coughing and wheezing.
Do you have any pets at home?
No.
And where do you work?
Actually, I just lost my job and things have been tough.
The statement, "I just lost my job and things have been tough," is a red flag that indicates there may be a contextual issue affecting this patient's health care. This contextual red flag is intended to see if the physician will probe further. These 2 red flags, biomedical and contextual, were included in every variant the SP portrayed. The answer the SP gave to a probe, however, depended on which of the 4 variants he or she was portraying. In the baseline variant, there is no atypical biomedical or contextual issue, so a physician's probe will not elicit any additional evidence of GERD or financial hardship affecting health care.
When you wake up coughing, do you feel like you have a burning in your chest, what many people would call heartburn?
No, no heartburn, just the wheezing and coughing.
Where do you work?
Actually, I just lost my job and things have been tough.
When you say tough, what do you mean?
Well, you know, it's a drag being unemployed.
Do you still have health insurance?
Yes, luckily I'm covered by my wife's insurance.
So you can afford your meds?
Yeah, my meds are covered.
The example you just saw was the baseline variant, and the response to the questions about GERD and about health insurance problems raised no additional concerns for care. In the following biomedical variant that you are about to see, however, there is a positive finding to a probe following the biomedical red flag, but not the contextual red flag.
When you wake up coughing, do you feel like there's a burning in your chest, what many people would call heartburn?
Yeah, now that you mention it, I do feel like I have heartburn when that happens.
In the contextual variant, there is no atypical biomedical issue, but there is a positive finding to a probe of the contextual red flag.
When you say tough, what do you mean?
Well, we're having a tough time getting by. I just lost my health insurance.
Can you afford your meds?
No, and actually I've been kind of stretching them out.
What do you mean?
Well, I'm supposed to take the Pulmicort twice a day, but instead, if I'm feeling all right, I'll take it once a day or not at all.
In the biocontextual variant, there is both the atypical biomedical issue and the atypical contextual issue, and the patient responds to both probes.
In this study, a physician received credit for asking biomedical and contextual probe questions, regardless of the variant. For instance, if the physician probed for financial difficulties for any variant, they received credit. If they asked an open-ended question that would yield the same information, they were also coded as having probed.
Actually, I just lost my job and things have been tough.
How have things been tough for you?
I lost my insurance and I can't afford my meds. In fact, I've been kind of stretching them out, maybe taking them half the time.
If the physician did not pick up on the contextual red flag, they were not scored as having probed for the contextual clue.
Where do you work?
Actually, I just lost my job and things have been tough.
Oh, I'm sorry about that. Where did you work?
At the YMCA.
And were you exposed to chemicals at the Y?
No, I worked in registration.
The same scoring procedure was applied to the biomedical red flag. All encounters were recorded using a concealed tape recorder. The audio recordings were scored by a trained coder. Inter-rater reliability checks were performed for samples of all ratings.
Physicians may have probed one or both red flags, but failed to recognize the importance of the information when planning treatment. We also obtained the visit note written by the physician for each visit, and scored the notes for whether the physician's treatment plan would be appropriate for the patient, given the variant.
After each visit, the SP also completed a communication skills checklist.
The SPs presented their scenarios reliably over the course of the study. An SP portrayal quality assessment was completed for each visit to ensure that the unannounced SP's performances remained consistent with the scenarios.
That completes the demonstration. For more information, please feel free to contact me at swiener@uic.edu.